Have you ever considered the rigorous systems in place that ensure your medications are safe, effective, and reliable for patient use? This is the domain of cGMP, Current Good Manufacturing Practices, which set the foundational standards for pharmaceutical quality and safety. Today, we will explore recent regulatory updates and highlight critical quality principles that are essential for compliance and operational excellence. To begin, Health Canada's updated Natural Health Products (NHP) Guide is introducing significant changes to regulatory expectations. By March 2026, all manufacturing facilities will be required to enhance their quality management systems, implement robust electronic record keeping, and clearly define accountability for all quality-related responsibilities. Data integrity is now a primary focus, with regulators emphasizing more thorough inspections of audit trails, electronic signatures, and comprehensive system validation processes. The ALCOA+ principles, ensuring data is attributable, legible, contemporaneous, original, accurate, and more, are now considered the minimum standard for compliance. When it comes to outsourcing and working with third-party suppliers, regulatory expectations are even more stringent. Companies are now held fully accountable for the quality performance of their external partners, requiring stronger contractual agreements and more rigorous oversight of outsourced activities. Turning to the United States, the FDA's latest draft guidance introduces further changes for manufacturers. The key update: relying solely on process models is no longer sufficient to demonstrate product consistency and quality. Organizations must now implement in-process testing procedures and establish controls for every production batch. Even with the adoption of advanced manufacturing technologies and state-of-the-art equipment, manufacturers are still required to conduct real-time confirmatory quality testing. Now, let's explore some interesting facts about cGMP and the impact of quality on the pharmaceutical industry. In the pharmaceutical industry, most critical audits are conducted without prior notice, ensuring genuine compliance at all times. This approach is comparable to an unannounced examination. There is no opportunity to prepare in advance. Even seemingly minor details, such as the type of pallets used, are regulated. Wooden pallets are strictly prohibited in clean storage environments to prevent contamination. Laboratory clocks must be synchronized with analytical instruments. Any discrepancy can compromise data integrity and lead to regulatory findings. Accurate timekeeping is essential. Even minor timing errors can have significant consequences. In one notable case, a global pharmaceutical company incurred greater expenses destroying non-compliant batches than the value of their finished products. The financial loss exceeded $100 million in a single year. Investing in comprehensive employee training is significantly more cost-effective than managing the aftermath of quality failures. For example, an injectable drug manufacturer determined that each error made by an untrained operator resulted in losses of $500,000 or more due to rejected production lots. Consider the Tylenol recall that occurred between 2010 and 2011, a pivotal event in pharmaceutical quality history. That single recall resulted in over $1 billion in losses, along with significant reputational damage and legal challenges. The impact of a single negative audit should not be underestimated. It can have far-reaching consequences for an organization. An import alert can halt an entire supply chain overnight, disrupting business operations on a global scale. Notably, more than 70% of global GMP warning letters are attributed to data integrity deficiencies. Issues with electronic records, audit trails, and documentation continue to present the most significant challenges across the industry. Is quality assurance merely a regulatory requirement to be checked off? In reality, it is far more than that. According to McKinsey, failures in quality cost the pharmaceutical sector over 20% of total revenues. However, organizations with best-in-class quality systems can reduce these losses by half. Ultimately, quality management is not solely about regulatory compliance. It is also about cost savings, protecting organizational reputation, and in some cases, safeguarding the entire business. The next time you take a medication, consider that behind every dose lies a comprehensive system of quality assurance, industry insights, and the dedicated efforts of professionals working to ensure your safety. Thank you for your attention. Remain inquisitive and continue to prioritize quality in all aspects of your work.